Hey everybody, welcome back to the EKG review of the day. My name is Reed. I really hope you enjoy this content, and if you do, please subscribe and come on the journey with us all. So let's get started with this EKG here. So first thing I like to do is I like to look at the forest, and I define the trees of the forest as our QRSs. And so I tend to just browse through the EKG. I might start down here at lead 2, and I'll notice that I've got these wide complex QRSs that appear to be occurring at a very regular interval. My rate here, if I maybe count from this wave right here, would be 300, 150, 100, 75, 60, 50 would be there. So somewhere in between 65 and 50, maybe 58 beats per minute. So somewhat regular. You could say this is just slightly Brady, but I would say close to a regular rhythm in terms of regular rate. And so we said this is a wide complex QRS because we look at it's a very slurry, it's not a very sharp looking QRS, and the QRS duration is greater than 120 milliseconds. So we would classify that as wide. Okay, so let's go ahead and figure out what's going on with this rhythm. So first thing I'm going to do is I'm going to look for atrial activity. And I'm looking in front of these QRSs, and I'm not seeing any distinct P waves. And if I scan throughout the other leads, I'm not seeing P waves either before these QRSs. And so you wonder, is the cytosol not working? Is this atrial fibrillation? Well, we would expect atrial fibrillation to be irregularly irregular. So we don't have any P waves, so is this maybe sinus node dysfunction? Is this AFib? And so something I want you to consider is, well, AFib we like to think would be irregularly irregular. But what about this rhythm makes us think that this could still be AFib that is regular? And if you look over at V5 and V6, what you're going to notice is right in front of these QRSs, we've got pacing spikes. And so when you see pacing spikes in front of a wide complex QRS, you know that this rhythm is being ventricularly paced. And so that would make much more sense that this individual has atrial fibrillation, and they also have a third degree or complete heart block. And that third degree or complete heart block is an AV node block, and we know that the AV node would conduct that typical atrial fibrillatory signal down to the ventricles in an irregular fashion. But because this individual's AV node does not work, they require a ventricular pacemaker to pace the ventricles for them. And when you pace the ventricles, you get this wide complex QRS that occurs just after that pacing spike. Wide complex QRS that occurs just after that pacing spike. And so that is why this person has a regularized rhythm in the setting of AFib, is because the rate of the ventricular depolarization is due to the ventricular pacemaker and not due to the fibrillatory waves that are irregularly pacing the ventricles. And so what is our diagnosis for this individual? We've got atrial fibrillation. I would say this is a more of a fine AFib with ventricular pacing. If you want to know more about how pacemakers work and the difference between atrial pacemakers and ventricular pacemakers, I would definitely urge you to check out my pacemaker video where I go through all the different settings and what exactly the EKG is going to show for each of those settings and why those settings are what they are. But long story short, we see pacemaker spikes. You zoom in, I see a pacemaker spike that occurs just before a wide complex QRS. So I know that that is a ventricular pacemaker spike. And in the setting of no organized atrial activity, I can conclude that this is fine atrial fibrillation with ventricular pacing. So I hope this helps. Have a great day.